Hello, I'm Dr. Sandy Chapnick, and welcome to another episode of You and Your Health. Just a couple of weeks ago, I was fortunate enough to be invited to a health fair put on by FLIR Systems, and there was a number of different practitioners and health-related venues about, and I happened to run into tonight's guest. And after chatting for a little while, I thought, what a perfect person to be on our show. I know we've had acupuncturists in the past. That really hasn't been for quite some time, but I was so taken with her confidence and her ability to speak about acupuncture that I thought that she would be a great person to introduce acupuncture and the theory behind acupuncture to my guests. So I asked her, she said yes. So I would like to tonight introduce you to Cynthia LaBruzzo of East West Acupuncture in Chelmsford, correct?
East West HealthWorks.
East West HealthWorks, I apologize. So let me give you a little bit of background on Cynthia. She's been in practice for 20 years. She's studied both here and in Asia. She's a faculty member of the New England School of Acupuncture and a former clinical supervisor. She was the head of the Chinese medical program at the East West Institute. She served as an expert on a small nationwide panel that was consulted on research conducted by the National Institute for Health and the Harvard Medical School. And currently, she's writing a book on Chinese medicine, another author. Welcome to the show.
Thank you. It's nice to be here.
So I can't even begin to tell you how often patients of mine say, so doc, what do you think? This acupuncture, is it real? And I always chuckle because it's only been around for, what, 5,000 years?
Yeah.
Yeah.
It's the longest practiced medicine, continuously practiced medicine in the world, so yeah.
Yeah, somewhere around 5,000. And I say to them, so if it's a scam, it's the best scam on earth. And the way I look at it, it's another way to help the body heal.
Right.
And I still think that it's still fairly misunderstood, as a lot of the alternative healthcare providers. So because I can't really speak with authority on it, I think it's great to have you here. So hopefully you can dispel some myths, give a little bit more information, and if we do have some time, maybe we can even do a little demonstration tonight so that I can show them that it doesn't hurt and it's actually pretty comfortable.
Yeah, actually, it gives a feeling of peace. So a lot of people, when they have acupuncture, end up really liking the feeling, to the point where they actually ran a study to see if people could become addicted to it.
Really?
Yeah.
How did it work out?
You're not going to become addicted to it, but it does the same thing in part that running long distances do. That kind of runner's high.
You know, I just completed my first half marathon. I was waiting for that runner's high to kick in. I got to tell you, I never had it. I was just thankful that it was over when it was over. So, but I can understand the theory behind it, and I guess it kind of makes sense. So, I guess acupuncture comes under the heading of Chinese medicine.
Correct. Yeah.
So, give me an idea of how would you describe Chinese medicine, and how does Chinese medicine now differ from, let's call it Western medicine?
Okay. Chinese medicine includes a number of things, from diet and certain movements, breathing, acupuncture and Chinese herbs, which is a very, very long history also. And Chinese medicine and Western medicine differ in that Western medicine tends to focus in on the specific problem.
The ailment.
Yeah, to the exclusion of everything else, without seeing how if one system breaks, it affects all the other systems.
Yeah.
And there's also a real aggressive note to Western medicine. We wage the war on cancer. We fight disease. Mm-hmm. And anytime you have a war going on, you have casualties. So with every benefit to Western medicine, there's also some side effects that go with it. And in chronic diseases, the side effects can start to outweigh the benefits.
So far, I can't disagree with anything you just said, being a chiropractor. So acupuncture comes under the heading of Chinese medicine. Now, can I assume that everything you do in your office takes all these factors into account?
It does my office, but in the state, you can become an acupuncturist without becoming an herbalist.
Okay.
To become an herbalist, I believe, is another 500 hours.
Okay.
So.
Can I assume that you're an herbalist as well?
I am.
So what is the schooling that goes into becoming an acupuncturist and an herbalist?
You need to have a bachelor's degree, heavy in anatomy, physiology, biology. And then after that, it's 4 years post-grad with a 1-year internship.
So it's pretty heavy.
Yeah, yeah.
And I'm sure most people don't recognize that.
I don't think people realize it. I mean, I didn't. When I went to school, I thought, hey, I could become a hairdresser or I could become an acupuncturist. You know, it didn't strike me that a difference in schooling involved.
Yeah, the Blaine School for Acupuncture.
Right. But I got fascinated by it, and so, you know.
Can I ask you, what made you make that turn to acupuncture versus hairdressing?
Well, I wasn't really going to do hairdressing.
I know.
But I was, at the time, director of broadcast media in an ad agency.
Really?
Yeah.
Okay, so this is career number 2.
Right.
Okay.
And when my daughter was born, they took her temperature. She was 104. And the doctor said to me that morning he had pulled pus out of another baby's spine. And he said, that baby will never be right. So he IV'd her, and cast her arm because she was so little.
How old was she?
Newborn.
Oh.
And they handed her back to me, and I said, she's cool. You know, she doesn't feel hot. And they retook her temperature and said, she's fine. But we don't dare, you know, we don't know why she went up. Take her off these antibiotics.
Right.
And then after that, I don't know if that interfered with her immune system coming up or if there was a problem from the get-go. But she just got sicker and sicker and sicker. And you know, I would have hung a chicken over her head, and
if you thought it would work.
Yeah, I would have done anything, and I just kind of promised myself I'd do anything in my power to.
Isn't that what a parent does?
Yeah, yeah.
So it led you to acupuncture,
which was the one thing that turned her around, and I went in very skeptical. So when it did, I didn't get why it would work, particularly on a child where you don't have any placebo effect going.
Right. So can you give me the idea so that they can understand, and then maybe I can explain to my patients a little bit better, how does acupuncture work? What's the theory behind it? Can we do that within the next 30 seconds?
I can try. It's the million-dollar question. I don't know that it's been answered, at least satisfactorily, to the West. The Chinese talk about qi, which is loosely translated as energy in the body, and that's what you're affecting. And we do know in the body that the brain, cessation of electrical activity in the brain is brain death. The heart operates on a pacemaker, which is a little electrical current, your muscles, your nerves, and that may be part of it. So the West has looked at the nervous system, it has looked at blood chemistry, it knows that acupuncture affects that. But I don't think, it doesn't like the idea of qi, that's too nebulous for it, and it doesn't have all the pieces to the whole picture.
And I don't need the explanation for Western medicine, because I often don't care what they say. I want to be able to understand, for me, how it's explained by you, not to the satisfaction of them.
Okay.
So energy works for me.
Okay.
Affecting the nervous system works for me. Affecting the cardiovascular and blood chemistry works for me. And if that's, so does it, I've heard it say that it removes blockages. Is that?
Yeah, I mean, one of the ideas is that pain, in particular, is a form of stagnation. It's a stuckness. And pain can be depressions, emotional pain or physical pain.
Okay.
And so you need to remove that blockage. And it's interesting now in Western medicine, they're using antidepressants to treat physical pain.
Yeah. Yeah, how's that working?
I don't know, but they have now kind of incorporated the idea that both those pains are coming from the same place, at least, in their treatments, as opposed to cutting the head off from the body and treating them separately.
Yeah, I don't think that's really ever worked. So what are some of the more common reasons that people come to see you?
I would say chronic pain's the biggest one.
Okay.
Other things, recently there's been a bunch of studies on infertility, so I see a lot of people for infertility.
So they're actually doing studies on that?
Yeah, in fact, a lot of the repro clinics are referring them into my practice.
Wonderful.
And you can do it on its own. You can do it in conjunction with IUI or IVF.
Have you done any work in conjunction with chiropractic? Because there are studies now with infertility and chiropractic.
That I haven't done. I've done a lot of stuff with chronic pain with chiropractic, but I haven't ever known anybody who was going in for chiropractic when they were coming in.
Actually, there's somewhere between a half a dozen and a dozen women that have specifically come to our office for fertility work that have ended up with children because of what we've been able to accomplish.
Oh, that's wonderful.
Yeah, that's,
I mean, it's a great feeling to think these little people are traveling in the world because
of something you did.
Yeah.
Yeah, someone comes in with back pain, someone comes out with a baby.
Right.
This wins.
Yeah, I had somebody come into my office the other day, and she said, she came by to thank me, and she said in front of an office or a waiting room full of people, this woman got me pregnant. And I thought, well, that really doesn't sound quite right.
Well, it works a little bit better for you than when they say, and they introduce me,
Right.
This is my chiropractor, he got me pregnant. Yeah, that doesn't work so well. So you're seeing more visceral type stuff as well?
Well, I'm not sure what you mean by visceral.
Visceral, like stomach and things like that?
Yeah, infertility is a big one, anxiety, depression, menopausal, since the whole problem with hormone replacement therapy has come up, is a big one, PMS and that type of thing, hormone problems.
Okay.
Also, I see a lot of neurological, GI, digestive.
Okay. Well, there seems to be so much crossover with what you do and what chiropractors do. So I can see why this could be a very good marriage here, so to speak. So when someone comes in to you on their first visit, what can they expect?
They should probably allow for an hour. I get a medical history. I explain, I can give them a better prognosis after that, telling them whether acupuncture will be effective, how many treatments they might need, and how those treatments should be timed, and answer any questions really that they have.
Typically, and it's probably a range of how many treatments someone might need for a particular condition. Let's say you're seeing someone for infertility, and granted, I know that there's probably even with that a wide range, but can you give me an idea of what maybe they can expect?
That's a really hard one.
Okay.
Typically, the people I have studied under have always said, caution the patient to be patient, saying 6 months to a year up to. But it really depends on what the issues are with the person.
Of course.
If they are not menstruating, then you have to get them back in cycling before you can even do anything.
Sure.
Whereas if they come in, like a lot of people do, with infertility from unknown causes, that is certainly a lot easier.
Okay. So after that first visit, talk us through a little bit of what they can expect on each treatment visit.
Okay. Each treatment visit, I'm going to need an update as to how they're doing. I'm going to take their pulse. I'm going to look at their tongue. The pulse is a much more detailed thing than what we do in the West, which is really just feel for the speed and maybe the regularity of it. There's a whole bunch of other dimensions you're checking on.
Okay.
And that gives me some feedback besides what they tell me. And then I tweak the treatment and they're back on the table. They need to lie with the needles in for 20 to 30 minutes. After about 5 minutes, they get the sense of being centered and calm and having a sense of well-being.
Okay. Wow, okay. So it's each time is about 15 or 20 minutes, roughly?
No, because they have the needles in for 20 to 30 minutes, and then I have a conversation with them, so it could go up to an hour.
Got it. All right, so the whole needle thing.
You know, I was never scared of needles. It's the number one reason people tell me they took so long in coming in.
Yeah, that's why it took me so long to have my first acupuncture. I have one of the many reasons I became a chiropractor is there's no needles and no body fluids. So, there was certainly a fear on my part. But having been under care before, I know it doesn't hurt.
Right.
And are you willing to, do you think it's a good time now to show them that it doesn't hurt?
Sure. You want to be needled?
I would be happy to.
Okay. Let's see. I have a few things here I have to get out. So this is just a little rubbing alcohol.
Okay. So sterilization is a smart thing to do at this point.
Yes, it's always a good thing. In fact, years ago, they had somebody from China in who was really well known, and they wanted me to teach a class with him. And I didn't think I was on par with him, but the reason came out. They wanted to make sure that he was using, you know, a clean needle technique at the school.
Okay.
Which doesn't mean that he wasn't using it. They wanted some backup.
Absolutely.
In case the standard was different. So this is a needle.
Okay.
It's in a tube, which helps to support it because the needle itself is so fine. And then it goes in, and then you adjust it for the depth. This is a very famous point. It's very, very good for problems in the front of the face, frontal headaches, sinus. They use it actually for dental. So
Really?
if you can't have anesthesia during dental procedures, they'll use this point with electricity.
Right. And I also know that even one of my dentists in the past used that as an acupressure point.
Yes, you
to
can.
help control pain.
Yes. You can use this at home. You find it's at the high point of the muscle here. And if you pinch, it actually is more sensitive when you're on the point than it is in surrounding areas.
Right.
So if you have a headache in the front of your head and you kind of put some pressure on that for a minute or two, it's going to help your headache. If you have one on the back of your head, then maybe you want to press in and up under your occipital belt, under your skull. Yeah.
Yeah, and I can honestly say that I have a needle in my hand. It doesn't hurt.
Right.
I didn't even know that it was in initially, and it's just sitting there.
Yeah, often when I go to take needles out of people, they'll say to me, I didn't realize you put that many in, because a lot of them you don't feel at all.
Right. So typically now, if I was coming to see you for whatever, it would be a series of needles.
Yes.
Typically, is there like round numbers how many you might put in?
That can vary considerably, but usually it's between 10 to 20.
Okay.
I mean, there's some conditions, you know, if you have some sort of paralysis where you really need a lot of needles and a lot of heavy needling style. There's other things like anxiety, which is few needles and a very light needle technique.
Now, I know there are other forms. I remember something called cupping.
Yep.
And then there was something with like a burning, not an incense, but something was burning, and I can't remember what.
Yeah, moxa.
That's it. Okay. So is that things that you use as well, and when would you use things like that?
Do you want me to take that out, or?
I have no. It can sit in there for as long as the show lasts.
Mox is great. I use it a lot for the type of arthritis where it's bad when it's cold and damp. It puts a penetrating heat into the joints and really helps loosen them up.
So it probably feels pretty good.
Oh yeah, it feels wonderful. You wouldn't use it with the type of arthritis where it feels really inflamed.
Okay. So more the chronic, long-standing type stuff?
Right, right.
Okay. So, you know, one of the things that I'd said off camera, and I always like to ask practitioners, I mean, I know I have some amazing stories that I've told along the way, stuff that makes me feel really good. So you've been in practice for 20 years, you've experienced a lot. So are there patients that kind of stand out or cases that stand out in your head that you can share with my guests?
Sure. I mean, there's a lot of cases that stand out. I think the ones when I first started out stand out the most. And one was this little short Italian lady that I had to get a special chair for her to get on the table. And back 20 years ago, in order to come in for acupuncture, you needed a note from an MD with a diagnosis on it. Not a referral, just a diagnosis. When she came in, she didn't have the note. So I treated her anyway and told her she needed to get it. She came in again. She came in about 3 times. And the reason she was coming in is she had a large fibroid. And it was causing a lot of pain. And she started feeling much, much better. Well, on her 3rd visit, she gives me a note from her doctor saying, she needs an immediate hysterectomy. We believe this to be cancerous, and you know, anything that you're doing right now that's distracting her from getting this is a disservice. So I told her I couldn't treat her anymore unless she got a second opinion that would say that this was a reasonable approach. So she went back actually to the first doctor for her second opinion. She didn't quite understand that you usually get it from another doctor. But when he imaged her, the fibroid that was the size of a grapefruit was down to a walnut. So that was really good feedback that not only was the pain going, but the condition was.
So I'm curious, did we get any more information from the medical doctor afterwards? And what did the medical doctor say?
He said to go ahead and pursue it. He could rule out cancer at that point.
Wow.
Yeah.
Fabulous.
And 20 years ago, that wasn't something you heard a lot.
Did the medical doctor give you credit for what was going on?
He didn't know if it just was coincidental.
There you go. That's what I was going for.
Well, that was the big one. It was either, if you got better, it was, back 20 years, the temptation was for doctors to say it's placebo or it's a coincidence. But now, you know, the majority of my patients, their doctors are telling them to get in. In fact, I had a woman the other day, she came in for a treatment. I told her she wouldn't see any results till about the 4th treatment. She didn't get any results after the 1st. She stopped and her doctor said, how many did she say to go for? Well, you need to go back and go for those.
Wow.
So
that's fabulous.
Yeah.
So there's a tremendous acceptance now.
There's been a real big turnaround since when I started out, yeah.
Well, things, you know, I think that people, especially with the internet now, know that there's so many more things out there for them, and they're exploring more things. And I think the medical doctors are having to realize that this doesn't have to be a war.
No, and you know, logically to me it makes more sense to do something that doesn't have feeling
side effects?
Yes. And if to me, you would start with something like acupuncture or chiropractic, and then if you don't get the results you want, think about steroid shots or painkillers or surgery. But that wouldn't be my first stop. That to me is counterintuitive.
Right. In chiropractic, we understand that the body is built to be able to heal itself, and that if it's not, there's some sort of blockage somewhere. That something is getting in the way of the healing ability.
Right.
And if you work to free that, then the body, because of its magnificence, just does what it's designed to do.
Right. Right.
And then that's working with the wisdom of the body, not against it.
And a lot of the treatments that we do now are actually counterproductive. If somebody gets a cold or a flu, your body's trying to get the germs out. But what do? We take all these things to dry ourselves up and stop us from coughing. If you get a GI bug, you take things to stop vomiting, or the other end. Yeah.
And I'll ask my patients a similar question. If you vomit, does that mean you're sick or your body's working properly? Right. And it confuses them initially. And then when I explain it, that, well, there's something in your body that your body wants out.
Right.
So you would be sick if it wasn't getting it out.
Right.
So.
And actually, I own a horse, and one of the #1 causes of death for horses is stomach problems because they cannot vomit.
Interesting. Now, do you do acupuncture on your horse?
I have. She's a little spitfire, and one day I had her out and she reared back and smacked her back into a tree. And I had the vet come over, and she said she broke the base of her tail, but there isn't anything we can really do about it.
Right.
But she had a very high carriage to her tail. It was a very beautiful way she carried it.
Okay.
And now it was pasted to her bottom.
Oh, no.
And it wasn't as attractive a look. So I was out there with my needles, and now she's holding it back up. And
beautiful. There's also chiropractors who take care of animals.
Yes, yes. I actually have a massage therapist too, who will come over, and if the horse has sore spots, work on it. Yeah.
Well, that's a whole different topic, though. So we actually don't even have much time left. This went by really, really quickly. So can you just, in 30 seconds or so, kind of share with them what you want to share with them about who you are and what you're looking to accomplish?
Wow. I really love the field I'm in. When I was in advertising, I used to do a lot of extra volunteer work because I didn't feel I was giving much back. And this is a really feel-good job. And I really try to work hard to make it a whole kind of encompassing thing where we're addressing whatever problems are going on from many different angles and working together to get the patient the best that we can.
Beautifully said. Beautifully
Thank you.
said. And just so that everyone knows, yes, it's been in the whole time, and it doesn't bother me. It's easy. For me, Dr. Sandy Chapnick and Cynthia LaBruzzo, I hope you have a wonderful month, and go Yankees.
Thank you.